Hi, I'm Mika. I'm the practice manager at Stable Health. This video should offer you some valuable insight and practice tips as a therapist from a patient's point of view. These tips should help you communicate and connect with your clients. Hi everyone, this is Mel. She's one of our regular patients here at Stable, and she's gracefully allowed us to pick her brains about her experiences here. Mel, would you like to introduce yourself?
Yeah, no problem. So I'm Mel. I work in an office job in Melbourne. About a year ago, I suffered a lower back injury. So I'm at Stable now, and I visited about 2 times a week for the last 9 months.
Wonderful, wonderful. All right, are you ready to get started?
Yeah, absolutely. Let's do it.
Excellent. So have you had any experiences with any other remedial clinics besides Stable?
I have. I've seen a few. I used to go there on a more casual basis though, rather than regular. Particularly if the pain was acute or it was really unbearable, I would go in. And then if they fixed me, I would just stop doing it. So, I think at the beginning, I really wanted to get better. I wanted to be better. But I don't think I was getting the results that I expected until I came here.
Okay, and why do you think that is?
I think it's partly my fault. It's partly my fault because, I would fall back into old habits.
Sure. So
I, forget posture, I'd forget doing my regular exercises. I didn't get reminders for these sorts of things. So I just found, and I wasn't really going back regularly enough as well. So those are the reasons, yeah.
And how do you think the therapists at Stable have helped?
I think the therapists here are really engaging. It's not like you have one appointment and then they switch on, but then thereafter they're just completely switched off. I think that they actually play a really active part in my treatment plan.
Oh, wonderful. Can you give me a specific example of that, maybe?
They tend to. What I like the best about Stable is that they make appointments around my schedule instead of offering just limited time slots.
Yeah.
It's really easy to forget because I've got my kids and they're always keeping me busy. It's really nice to have someone give you reminders as well. I think that they're really good with that. And it's nice to have the reminders to make sure that I'm still on track and that I'm not forgetting my exercises and that, there is some progression in my condition, that it's being improved and that what I'm doing is actually still relevant.
All right, and on that point, what are some of your expectations of a therapist?
I really value professionalism, and I also think it's really good to have a therapist that demonstrates their knowledge and their expertise in their area. And I think the most important point for me personally, and I think this would be for a lot of others as well, just to have a therapist that you feel comfortable with. Of course, absolutely. It's really important.
Speaking of being comfortable, what can a therapist do to make you feel that way?
I think it's just the little things, just remembering my name, even knowing the details of my condition as well. That's really important. I think familiarity is a really important point when it comes to a therapist. Just talking about things that aren't even injury related, like how's your kids,
absolutely.
How's work, having an interest in me is really important. And I think being comfortable with a therapist is a process in and of itself, just like, building any other relationship. Yeah. I don't think I can think of anything else, but what do you think?
Look, those are some really important points. I'd have maybe one other thing I would like to add is something that really helps build the client and therapist relationship is actually celebrating the progress together. It makes it feel like you're actually doing some teamwork.
Yeah, I agree. So, it's like acknowledgement that, for example, I could do this or that movement that I couldn't do at the beginning.
Yeah, absolutely. Ultimately, it's about helping you recover and making you feel your best.
Yeah.
All right, Mel, thank you so much.
Nice
to see you again.
Likewise.
And we'll see you Wednesday?
Yes.
Wonderful.
Right.
Some other suggestions we have from a management point of view is inquire about what's helped them in the past. Ask them if they've seen any improvements since their last treatment. Ask them to come back in a week or two to both consolidate their gains and to follow up with any treatment plan. Do this by finding out what day they are available. If you're confident in your ability to improve their condition, you should show it. Be proactive. Send in a check-in SMS to your clients to see if they've been doing their take-home exercises. Send them an email to see if their headaches have been reoccurring. It's little things like this that can make a huge difference before a follow-up treatment. In other words, engage with the patient. You do and can make a huge difference to someone's everyday life as a therapist.